Assalamualaikum doctors. In this video I am discussing about spina bifida. It's very common, it comes on neurology clinical examinations. So normally bedridden approach it comes, like if the patient is bedridden, ask the mother if he can walk or any supporting aids. So if he can walk, we ask. Causes of, maybe upper motor neuron lesions like quadriplegia, double hemiplegia, diplegia, hemiplegia, or lower motor neuron lesions, spina bifida, spinal muscular atrophy, Duchenne muscular dystrophy, advanced GBS. So remember SMA type 2. Landmarks for each are spina bifida, we find big ugly scar in the back. Look for nappy or urinary catheter. So big ugly scar we are finding. SMA we find spinal muscular atrophy, tongue fasciculations. That is the tongue fasciculations. Duchenne muscular dystrophy, it is male. Cuff muscle hypertrophy, muscle biopsy scar in the thigh. So spina bifida I am discussing here. So general observations, what we find, the child, look the child from the picture, what we find, there is a ugly scar of the back, lower lumbar regions, and the head is very enlarged, hydrocephalus, and there is a shunt attached to the head. Okay, so general observations of spina bifida is that sitting, sleeping, head size and shape according to the findings, but do not forget to comment on the shunt for Arnold Chiari's syndrome. Mostly no dysmorphic features, normal speech, looks well communicating, hypotonic positions, truncal obesity, still in nappies with or not urinary catheter, also may have glasses. General examination we find wasting or not symmetry, there is deformities, talibs, scars, trophic ulcers, bed sores and burn scars. Back is very important for scar of correction of spina bifida, still in nappies, bed sores. Now local examination, what we find, motor and sensory level, decreased tone, power and reflex, power 0 to 1, just flickering in the muscles, negative Babinski, no coordination, no movement, very important to search for sensory level. So they have decreased tone, power, reflex, power is 0 to 1, these are negative Babinski, no coordination, no movement. I would like to complete my examination doing the abdominal examination because end of the shunt, bladder size, fecal mass for stool infections. Then cranial nerve examinations, anogenital examinations because of the patula senas, groin scar for hip dislocations, repair and catheter. Then assess the vital sign, blood pressure, pulse for increase the intracranial pressure. Problem with the spina bifida are joint contractures. They have congenital hip dislocations, scoliosis, bed sores, incontinency of urine with recurrent UTI and constipations. So the problems are joint contractures, they have congenital hip dislocations, scoliosis, bed sores, incontinency of urinary catheter for recurrent UTI and constipations. Management treatment of the complications for recurrent UTI, intermittent catheterization, prophylactic antibiotic and oxybutynine. For constipation, high fiber diet, much fluid intake, washing bowel with enema. So recurrent UTI, we are giving prophylactic antibiotic, catheterization, frequent catheterizations, and constipation, high fiber diet, much fluid, and hydrocephalus, shunt, and if seizure, antiepileptic drug we give. And the multidisciplinary team we involve, we know that neurologist, physiotherapist, occupational therapist, psychological support to the family. These are any surgery team we are involving. And okay, advice for shunt, we are advising what if there is any fever, abdominal pain, vomiting, blurring of vision, seek medical advice. So some advice we given, it is very important. Shunt, there is any headache, morning throwing up, abdominal pain, seek medical advice. Foot care, like frequent change of the position in bed, avoid the latex and avoid contact with the hot objects. Okay, so foot care, mother to take high dose of folic acid next pregnancy. What are the questions? Causes of headache, shunt obstruction, shunt over drainage, shunt infection and hydrocephalus. So headache is hydrocephalus, shunt obstruction, shunt infection and shunt over drainage. Causes of abdominal pain in shunt, nephritis, peritonitis, infection, constipation, UTI. Infection, constipation, UTI, peritonitis. DDR, spinal muscular atrophy, Duchenne muscular dystrophy, GVS, transverse myelitis and T-third cord. Multidisciplinary team we will involve dietitian and respiratory. So dietitian and respiratory pulmonologist also we involve. This is all about spina bifida. And how can I present the case? So today I examine Ali. Suppose Ali is a 7-year-old boy who is well looking, no any pain and distress, well communicating, and he is small for age. So though I want to plot him on appropriate growth chart, I find we find there is, if any supporting aids I will mention that, any scar I find mention that. On examination I find From head we start that there is hydrocephalus. I find there is a shunt present, and main important is we find there is a scar lower lumbar region of the back. And if the child is wear catheter or nappy, we can comment on that nappy, catheter, wheelchair bound. And the examination neurology, what we find, decrease the tone, power, reflex. These are Babinski negative. We tell that. And I'd like to complete my examinations by doing, if it is common, other full neurological examinations like upper limb, cranial nerve examinations. These are. So this is all about spina bifida. Thank you.